Now looking at treatment for ice addiction. Go through proven treatments and then treatments that present some difficulties, and then look at some local treatment options for loved ones. So proven treatments include psychosocial treatments, ancillary treatments, harm minimisation, and help for families and friends. Some of the treatments that are a bit more difficult and uncertain include medications, residential rehab, and involuntary treatment. So what are psychosocial treatments? Essentially, they have a few core methods which have different applications. These core methods include cognitive, that is to do with beliefs and thoughts, such as replacing unhelpful beliefs with better ones. For example, the thought that or belief that I must respond to craving with drug use. This can be challenged and replaced with techniques of approaching craving and avoiding triggers which produce craving, etc. Another core method is a behavioural aspect, which is to do with rewarding target behaviours and practicing better behaviours. This may be, for example, doing physical exercise as part of a routine. It also may be doing things which are naturally rewarding. May also be consciously rewarding certain target behaviours. For example, attending a group may be associated with a reward. Social aspects of psychosocial treatment include the support of peers and working with a therapist. And then there's holistic psychosocial treatments to do with meditation, mindfulness, some philosophical approaches that help reframe the problem, and then faith-based approaches. And under application settings, it can be applied to individuals or to relationships. It can be in a one-on-one counselling setting or in a group therapy. It can be in a community environment or a residential rehab setting. So how effective are psychosocial treatments? It has to be said that the effect is modest, but it is a proven benefit. The size of the benefit is around about a third of people may stop using, a third of the people may reduce their use of methamphetamine, and a third of people there may be no benefit or no change in behaviour at that stage. The condition is, though, that it does tend to fall off over a 12-month period and needs to be sustained with an ongoing recovery program or relapse prevention program. Programs that incorporate behavioural rewards tend to have an earlier effect, but in the end have about a similar overall effect. The behavioural aspects may have a role in family training, which helps to reinforce behaviours and boundaries within the home. Ancillary or indirect treatment of the condition includes diet, exercise and sleep. These are obviously very important for people's function overall. Treating the psychosis, treating the depression when it occurs, treating infections and other complications. Housing and income are important. Obviously people can't be treated effectively if they're homeless or have no income or no support. And general support, that is a point of contact with the helping agency and if possible a case manager, is very helpful in coordinating someone's recovery. Harm minimisation may not be thought of by some people as treatment, but it is actually keeping people alive and healthy for the long haul of recovery. And it's important that when a person does succeed in getting some stability in their life, that they are actually as well as possible and then can enjoy a period of healthy life. So harm minimisation is extremely important in substance use. Looking at healthier ways to use in amphetamines may include safer injecting practices, not using alone or having a phone in case a person becomes unwell, having the options for safer sex such as condoms. In terms of memory problems, using sticky notes to remind people of appointments and meetings, things they have to do. Having a break from use at different times to allow the brain to recover. Attention to hydration and nutrition. Looking after the person's oral health. something to do with their physical energy caused by the substance use, such as a fidget spinner. This helps prevent picking. And then the needle syringe program is very important in terms of not only providing clean injecting equipment, but also communication about current dangers in the system, bad batches of drugs, provision of safer sex packs, and also referrals to treatment, for example, for hepatitis C or for other treatments such as counselling. Family and friends training is very important, and it's becoming increasingly evident that it has an important role in helping the person who is addicted as well. It involves teaching aspects such as self-care and safety for the family, healthy communication techniques or helpful communication techniques, regaining boundaries and control of the home situation and people's personal space, and behavioural strategies that help reinforce good behaviour and discourage bad behaviours. These techniques also need to be sustained over and practiced over a period of time, and so the best setting is groups meeting regularly and where mutual support can be offered and plans can be developed in more detail. It's all about practice and planning in terms of responding to the problems of addiction in one's family. It certainly is an underrated area, and studies have shown that in groups undergoing family and friends training, up to 70% of the addicted people end up pursuing treatment, so it is helpful in terms of motivating people into treatment early. One thing that people often ask about is medications for ICE treatment, or whether someone should do detox. Medications is an area where there's no proven benefit for amphetamine use. There's a lot of research happening in this area, but there are no available treatments. One area of research is stimulant replacement, and currently in the Hunter there is a lisdexamphetamine trial. This can be, if a person is suitable, they may approach the stimulant treatment program through the Hunter Area Health Service. It's again not a proven benefit, and it's a research trial. Another area of research is kappa receptor blockers, and this includes the drug buprenorphine, but this is only being used in a research trial along with naltrexone. Kappa receptors reduce craving for substances. In patients who have a coexisting opiate addiction who are put on buprenorphine, we sometimes see a reduction in amphetamine use, but this is not a proven benefit. And antidepressants, there are no proven benefits to antidepressants for amphetamine use. There's some early signs that mirtazapine may be a preferable antidepressant if someone needs one to reduce amphetamine use. Detoxification alone has no benefit at all. Patients will often go for days without using amphetamines anyway, because there's no physical withdrawal. So if a person does undergo detox, it is usually prior to doing a recovery program, such as a residential rehab or some other program following that. So what about residential rehab? This is often the first thing people think about when they have a loved one with substance use disorder. But in terms of all things being equal, the outcomes are no better than with other talking treatments. It really does depend on the particular setting, particular problems, individual problems of that person considering rehab. Getting in is quite difficult. There's often a waiting list, and there's a requirement to do a detox prior. Lining those things up together can be very tricky. Staying in rehab is more difficult, and many people will leave before 3 months. Up to 80% leave before 3 months, and this is the minimum time that has been shown to result in a benefit for people with moderately severe stimulant abuse. It's often expensive, particularly private rehabs, and their other drawback is it tends to avoid, or it doesn't present people with the triggers that they will face as soon as they walk out the door. Therefore, a person may be quite stable in residential rehab, but as soon as they walk out the door, are faced with many cravings and urges caused by those triggers. And the other drawback is that it tends to be a place where people will go in preference to going to jail, and therefore it's not a place for the more vulnerable people with a substance use addiction. Another area that people often consider for their loved ones is involuntary treatment, and the three options that might be available would include jail setting, a mental health institution, or under the Involuntary Drug and Alcohol Treatment Act, which people often are unaware of. The issues are that if a person is using substances, they need to be charged with a crime in order to go to jail, and this is often something that people are not prepared to do. In the case of somebody who is extremely chaotic, jail may be the only thing that actually slows them down and gives them a break from substance use. So this is not something necessarily to be fought, but maybe be beneficial, even with the difficulties and the problems associated with jail. Mental Health Act is really not particularly useful, except in just getting someone who is psychotic back to a non-psychotic state. It doesn't last. The admission doesn't last long enough for there to be any other therapeutic input, and the person is often refused entry if they are considered to have a drug-induced state anyway. The Involuntary Drug and Alcohol Treatment Act is accessed through the local health district through the Involuntary Drug and Alcohol Treatment Act Liaison Officer. This is a poorly resourced piece of legislation, and it could be said that it's only useful for people who are at imminent risk of death from their substance use. So overall, the involuntary treatment is limited to the jail setting, and this would only be considered for someone who would benefit from that setting, in balanced against the dreadful conditions that jail presents. So it's important in terms of matching treatment to the individual to think of there being a spectrum of intensity of treatment for substance use disorder, starting with an office-based counsellor, and this would be, for example, someone who can keep appointments, who's still relatively organised. They also may benefit from mutual help groups, but this also could be particularly useful for people who are not able to keep appointments. It's also very useful for family and friends, and it's that the social or peer support is very helpful in both for people who use and family and friends. Stepping up from there would be intensive community-based treatment, where a person needs intensive input and probably and preferably a community-based case manager. It's also very useful for pre and post residential rehab, where a person is exiting or preparing to go to that setting. Residential rehab really is best reserved for people who are fairly chaotic, have made no progress with community-based treatments, maybe at high risk for their physical or mental health, or have some antisocial behaviours which would benefit from the socialisation setting of residential rehab. And then for people who are at imminent risk of death or have a problem with their mental competency, then involuntary treatment may be beneficial. There are deficiencies in this spectrum in terms of provision, and certainly in the area of intensive community-based programs and case managers, there is a lack of this service, and there's also a lack of adequate involuntary treatment for people who are really caught up in addiction and really unlikely to exit under their own volition. So factors that may affect the choice of treatment settings would include the level of chaos in someone's life. A person who is mentally unwell or has a strong forensic propensity or is destitute, these people may gravitate more toward the severe end of the treatment spectrum. People with underlying personality disorder or trauma history will have a longer term recovery, and they may be better considered for a community-based treatment with a long-term treatment team or case manager and psychotherapist. Certainly people's personal resources and or their personal disadvantages have a role to play. Both intellectual and educational factors play a role. Their financial resources and the level of family support and family insight play a big role. People who are very vulnerable, particularly to abuse, one would be reluctant to see them going to jail. That would be a dangerous place for them. So what are the treatment options, considering that whole spectrum of drug and alcohol treatment? This is looking at the local treatment options in Newcastle. So with one-on-one counselling, approaching a GP for a mental health care plan and referral to a psychologist, particularly one with an interest in substance use problems, but many psychologists will be able to do cognitive behaviour therapy and help people with mild substance use disorders. New South Wales Health also provides specialised drug and alcohol treatment counsellors, and this can be accessed through the drug and alcohol treatment triage and referral service 1300 660 059. Non-government agencies such as Salvation Army can offer one-on-one counselling. This can be accessed also through their websites, through the drug and alcohol triage referral service, or through central contact points such as Lifeline. Mutual help groups are available by searching the internet for AA or NA or Smart Recovery Australia, and this will allow you to find local groups and their time of meeting. Specialised stimulant program or intensive community-based programs such as STP or stimulant treatment program is available, usually with a waiting list 4923 2060. That's run by New South Wales Health. There's also an NGO-based program run through the Samaritans Foundation in Newcastle. It's called ICE Recovery Group, and it's available through the Samaritans website, samaritans.org.au/service/the recovery point with hyphens. For people with coexisting mental health issues along with substance use, the mental health substance use service is available through the Calvary Mater Hospital, and that is through 4033 5600. It's usually post-admission to a psychiatric facility when a person's had a major mental illness, but also can be accessed by people in the community. It involves groups and assessment services for people with mental health and substance use disorder. Residential rehab is best accessed via the drug and alcohol triage service. Again, they will have a list of people and places to ring, and will help you work through the detox process, which is usually required prior to residential rehabilitation. Involuntary treatment, if one's considering the court-based system, then there are two options. Merit, which is a magistrate's early referral into treatment. This is for someone who hasn't been convicted, or there's drug court for people who have been convicted. Information about these programs can be available through the local courthouse or through your legal advisor. Mental health involuntary treatment is usually accessed through dialing 000 in an emergency, or through the assessment service or intake service 1800 011 511 for less urgent cases where mental health has become prominent. And then the Involuntary Drug and Alcohol Treatment Act can be possibly accessed through the local health district liaison officer, again via the triage service, the 1300 660 059. And harm reduction services are usually available in a fairly prominent place in most towns. most facilities are available through accessing the web and finding a list of locations, but in Newcastle it's through ringing 4016 4519. So that's the end of this talk on methamphetamine and other stimulants. Thank you for your attention. The next talk is how to help your loved one from the point of view of family and friends, and looking at aspects such as self-care, communication skills, regaining control of one's house, and in terms of boundaries and behavioural techniques to help your loved one. And the fourth talk will be about specific substances and their treatment, and that will cover alcohol, cannabis and opioids. Thanks once again.